Heart blockage is primarily caused by a couple of factors. So, the first thing would be deposition of cholesterol in the arteries that causes heart blockage. Secondly, this cholesterol, when it keeps on depositing over some time, it can cause a blockage. And sometimes the cholesterol plaques, which we call them, they sometimes rupture. And what happens that on that is that a clot forms on that, and it completely obstructs the supply to that region of the heart. So we have three main coronary arteries. So out of these three, if there is blockage in anyone because of this deposition of cholesterol, calcium, and also because of a plaque rupturing there and a clot forming there, so that is what causes a heart blockage. Heart blockages generally are, like I said, by cholesterol and calcium deposits, but they can also be because of sometimes certain procedures are being done, and air can go into the coronaries, or sometimes people can have fractures, and with that you can have fat embolizing into the heart, or you can have small clots, which might be somebody who's got a valve replacement. They might have small clots, and they might go into our heart vessels, and they can cause blockages. Other than that, heart blockages itself being a reason for heart disease or heart attacks, there is sometimes that there are certain types of heart attacks which happen even without having blockages. So that could be a patient who has a low hemoglobin, or has anemia, or the blood in our body, its major function is to carry oxygen everywhere in our body. So if our hemoglobin or blood levels are low, so that can also cause a heart attack. So the heart attack in that case is called a type 2 heart attack, and we have to treat it accordingly. So there are different types of heart attacks which can happen. Number one risk factor is smoking, and after that comes diabetes and high blood pressure. And stress is also another reason for causing heart blockages. Also, our diet plays a very important role in this, because our diet is mostly now westernized. So if you would see that most of the Western diet, it has a very high sugar and a high salt content. So with the high sugar and high salt content, these heart blockages are becoming coming earlier in people, in younger people, and with the use of smoking, it is coming earlier and in younger people, and also the disease is more complex now. A couple of symptoms of heart blockage are central chest pain in the chest. So this pain is generally, it will be like a weight on the chest, or the patient will say that it comes along with sweating, and there might be some breathlessness. So to judge these things, we have to see if the patient could do certain movements before, like walking upstairs. If he does that every day and he can't do it now, so this is a symptom. We have to see if he gets breathless on doing the same things that he never used to get breathless on doing before. Third thing is extreme weakness on just a little bit of physical activity. A fourth thing would be dizziness, or it could be syncope. Syncope is complete loss of consciousness just for a few seconds. It could be, or it could be just a near like a blackout. That could be one symptom. And it could be heart palpitations, that a patient is feeling his own heartbeat. That could also be a symptom of heart disease. And like I said, extreme weakness might be there, and also a continuous breathlessness on doing minimal activity. So these are certain symptoms of heart disease. If any of those symptoms happen, like the patient gets chest pain, radiating going to his shoulders, to his back, or to both arms, or to the left arm, or upwards towards the neck, or to the jaw, these are one of the very classical symptoms of heart disease. And especially if these symptoms go away as the patient rests. Supposedly he has these symptoms while walking, and they go away when he's resting, when he just stops. So this is one of the symptoms. So similarly with breathlessness, which comes on exercise or on some kind of physical activity and goes away. So these kind of symptoms, first of all, tell us that there is some heart disease. So secondly, for diagnosis, there are various tools that we can use. So a couple of them are stress echo. and an ECG, or we could do a cardiac catheterization. So I'll just explain these in short. So an echo simply tells you about the pumping function of the heart, how the architecture of our heart is, how the architecture of our heart valves is, and it gives you quite a lot of information. So that tells you at a baseline, is the heart functioning properly or not. And ECG at the baseline, it is a 3D electrical diagram of your heart. So it tells you if there is any loss of function in the heart, or if there is anything that is going on. So ECG gives an indication as to what could be an issue, and that can be further investigated. And the third thing which we could do is a stress echo. So stress echo is nothing but that we put the patient on the treadmill. We do an echo before, look at the heart at the baseline, and then we look at the heart when the patient is under stress. So when we raise the heart rate while patient is on the treadmill, and after that we do an echo, we can see if any part of the heart is functioning less, or is there any change in the functioning of the heart. That could also tell us a lot. The third thing we could do is a cardiac catheterization, which is a coronary angiography. So that tells us with that we go in and give some dye inside the heart, and it tells us where the blockages are. So these are a couple of things we can do to diagnose heart disease. But first and foremost are symptoms of the patient. The first thing would be to start him on treatment with drugs which are antiplatelet, and which help us in the further treatment of patient where blockages don't turn into 100% blockages with their clots forming. Second thing would be to take care of the patient's cholesterol levels. So if they are rising, so we can give drugs for that as well. Also, we can give drugs which decrease the workload of the heart so as to decrease the symptoms of the patient. Because everything in a patient who has some kind of cardiac symptoms does not mean that we simply take up that patient for a cardiac cath. We can start with the treatment if the patient is not in an emergency condition. In an emergency condition, treatment has to be started and patient has to be taken up for coronary angiography. But in certain cases, it is better to start with treatment first and wait for that. Everything on the top says lifestyle changes. Without changing the lifestyle, medication will be able to do some kind of benefit to you, but it will not completely benefit you, because lifestyle change is needed. It is needed for patients who have high blood pressure. It is needed for patients who have diabetes. It is needed for patients who have heart disease or any kind of lifestyle disease. So since we are talking about heart blockages, which is majorly a lifestyle disease, so the changes which we have to make to our lifestyle, number one is exercise. So our Society of Cardiologists recommends about 30 minutes of exercise, half an hour a day, for at least 5 days a week. But people say that they can't exercise and they've never exercised. Not to worry, you can start with 5 minutes and go up to 30. You can take your time. And another thing I'd like to mention is people with heart disease, they should always do some warm up before starting an exercise. Because the problem happens that in the first 5 to 10 minutes of exercise, people with heart disease, they are likely to have an event if they do not warm up. So number one is exercise. Number two is our dietary habits. Like I already mentioned, our diet is getting more westernized. We are moving from chapati to pizzas. We are moving to pastas. We are moving to bread. We are moving away from our traditional foods, which is in our Indian households, roti, sabzi. The moving away to a westernized diet is not right, because like I said, it's very high sugar, very high preservative, and very high in salt content. All these things play havoc with our system because it introduces too much sugar into our system, which we don't utilize. So this ultimately becomes into fats. And this is where most of our dietary fat comes from. Our dietary fat comes 80% from our dietary sugars. So that has to be kept in mind. So moving away from all these, I tell my patients generally to decrease their number of chapatis, bread, pizzas, pastas, and all the high sugar content, high carbohydrate diets, rather than move to fruits, which are natural sugars. And all these patients, even diabetics, can have at least one fruit a day. And moving away from this, I told people to decrease chapatis. So they say that how do we decrease our chapati intake, and how do we move away from taking chapatis? So I would say change the kind of atta you use. So rather than just a whole wheat atta, you can start using millets, that is jowar, bajra, ragi, and a portion of wheat in it. So that is how you can change your diet. And third thing is you can add salads to your every meal. So when you add salad to your meal, so what that does is it first of all fills you up. Secondly, it forms a kind of layer in your intestines, which helps filter out a lot. And thirdly, every time we eat, there is some amount of bile which is secreted out of our liver. Fiber or salad in our diet does is it binds to all this cholesterol in the bile and takes it out. It doesn't let it recirculate into the body. Whenever we eat, the timing difference between eating and sleeping should be kept a minimum of 4 hours. And the last would be stress management. So stress management, I have given this mantra out to quite a lot of my patients. So anything that is not affecting your year ahead, don't worry about it. Leave it, let it go. So that is a mantra for me, and I give it out to people. But stress management should be there. And of course, stopping smoking. That is one very big lifestyle change you have to make if you are smoking. We can prevent heart blockages and keep people healthier longer, and also keep them disease free. For even for people who have disease, so all these lifestyle changes are very necessary, because you consider this, the damage that happens from heart blockages has been happening over years. So all that damage, all that accumulation of cholesterol inside has been happening since the day we were born. So to change all that, we have to do these lifestyle changes and be consistent with them. And that is how we will prevent them. Because consider this, you have a large body, but you are taking small tablets daily for them. But if you are not changing your lifestyle, then it is very difficult.